I wish I didn't have to make this video, and I'm sorry it's not going to be polished. It's about childhood trauma. For context, I'm Dr. Matthew Glauderman. I've worked in crisis team, psychiatric hospital for a year, general practice, urgent care. I've done acute medicine, full circle view of healthcare. And I think a lot of times the people that have gone through significant childhood trauma are extremely misunderstood. That's the purpose of this video. And it's going to be hard for me to talk about it because I have such a sensitivity for kids, and like I could never be an oncologist in pediatrics because that would weigh on me emotionally. And the times that patients have shared their childhood trauma with me, it still weighs on my heart. And hopefully this video will help you break a cycle if you're in one where, you know, generations of people have went through childhood trauma in your family. Hopefully this video will highlight to you maybe how your brain processes things differently because of the childhood trauma you went through. So I think the analogy I use with my patients to try and explain it from a brain perspective and a brain development perspective is, imagine if your trauma as a child is you have an ice cream cone and it drops on the ground, and then you get upset, and then your parents give you another one. So that's like your graded trauma, like easing into it. But if your ice cream cone is watching domestic violence or being abused yourself physically or sexually, if it's, being neglected, your brain at that early stage in your life is processing things, and then the result of that processing, in my experience as a doctor, is like you tend to be impulsive. So you make quick decisions. You don't think about it much because when you were a kid, you had to make quick decisions. Like, do I run and get out of here? How do I protect myself? And so your brain is hardwired to do that. The next thing is people tend to do risky behavior because they've been around risky situations. So they take on risks that most people would think about and process a little more. They tend to trust almost no one in their life and struggle with interpersonal relationships. And you can understand why. Like, if your most trusted people, the people that are supposed to care and look after you, were abusing you or neglecting you, like, how are you supposed to trust anyone? The patients that come to see me, like, they, a lot of times they like barely say a word the first time they talk to me. Some of them different, but almost always they really struggle to get a rapport, and it really takes a lot of effort. I've been able to do it a lot of times because I'm able to talk to them and explain what I'm explaining to you right now in this video, why this is so important. But just asking someone bluntly about their trauma isn't how I go about it. I try and understand what their struggles are first, let them talk, even if they want to say 2 words to me first. I try and figure out when they were well, and a lot of times when I ask that question, so I'm screening a little bit, like, when's the last time you were well? Because I'm trying to figure out how long an illness has gone on for. And if they say, I don't remember when I was well, then it's usually a flag for me that there's some significant childhood trauma. And after I try and ask a bunch more questions, then I ask the question that is really difficult for them to talk about. And I preface it by saying, look, you don't have to tell me anything if you don't want to, but if you're really struggling with childhood trauma, like, tell me a little bit about that, and maybe they'll open up a little bit. Maybe they'll say very few things about it, but if they hint at that, even, I'm trying to explain to them why and how their brain might work differently than other people. People in a healthcare setting, they see someone that's impulsive, they see someone that doesn't trust people, and they struggle to understand that because healthcare setting is very fast. You gotta like quickly get answers, quickly get information, especially if someone's acutely unwell. For these types of people who don't trust healthcare professionals, who had this significant trauma, whose brain just works differently, you really need to pause, take time, and try and understand them. And in my experience, there are some people that have incredible resilience, and they're able to get through all that trauma and somehow form a life and form relationships, but it takes time, it takes trust, it takes a lot of work to get to that stage. And other people really struggle to cope. They might self-harm, they might use illicit drugs, they might, get into abusive relationships themselves because that seems, in their mind to be like, what's normal? There's something called an ACE, Adverse Childhood Experiences Test, that we sometimes use and I've helped patients fill out. And comparative suffering I don't think is useful. Like someone struggling with one thing and someone struggling with a different thing, comparing the two isn't appropriate. But understanding maybe what your score is, and I'll put a link down below, that might help you understand what you've went through in your life, and then hopefully help you understand with this video and a little bit of processing, like why you might act in a way that's different from the people around you. So I hope this video is helpful. I know it's a 5 or 6 minute video and that can't erase decades worth of difficulty, but if you struggling with childhood trauma, think about how your brain might process things differently. Think about how you might benefit from therapy and or professional help, and then maybe share this with someone you care about so that they might understand you and how your brain works a little bit differently than what anyone could have potentially said to you before.